I'm Dr. Caesar. My background's in clinical psychology and cognitive neuroscience. Um, I can talk a little bit about how I first got involved in this work. I do want to say I have to leave at 5. I have another patient to see, but yeah. So I started, working in the community in Vallejo. Actually, I think it was a meeting held at her offices at the time. And the impacted families at the time were basically calling for help and support because there was just case after case of police violence against members of the community, and not sufficient community response. So in listening to the families, obviously, the loss of life is really traumatic, but there's a lot, more that happens, in terms of abuses that don't get the same attention. And then the traumas that people experience, long after, the killings in the press for the killings have died down, also doesn't get a lot of attention. And so as a clinician, I kind of looked into the literature to see kind of what the research was saying about this and what are some appropriate interventions, what might be useful for the community, and saw that was really understudied. There wasn't a lot of research looking at the impact of exposure to police violence on community members and families, which I thought, was a shame and something that I thought, I should rectify, I guess. So just a little bit, I'm going to go over these briefly, but looking at, the COVID statistics. So these are age standardized distribution of race, and looking at COVID deaths. And you see that, for non-Hispanic whites, there is kind of a flip. The purple bars are the age-adjusted proportion of the population, and the red bars are deaths, age-adjusted deaths from COVID. And you see that there are fewer deaths relative to the representative population for white people, but for Hispanics and Blacks, you actually see there are disproportionately higher deaths relative to the proportion of the population that these racial groups represent, which, just tells you something that we already know, that, COVID is impacting, these racial groups to a larger extent. This is kind of another depiction of that. So at 0, you have an equal match in terms of proportion of the population represented and the impact. And if it goes above 0, then there's there's a greater impact relative to the population. If it's below, then there's a lower impact relative to the population. And you see for Hispanics and non-Blacks by age, there's a greater proportion. So why is that? This is probably something people know already, but race, isn't a predisposing condition for COVID. There's nothing specific about race that makes COVID more deadly for people. Racism is a predisposing condition for increased mortality for COVID. And so why is that? Why is racism? Why do people die more often because of racism? There's been discussion about ACEs and toxic stress. I think everyone is probably pretty familiar with that. But the way the stress system works, stress is not a bad thing. It can be positive. If there's something that you need to do, there's an increase in stress, and that can be motivating. If there's something, maybe there's a big test or something like that, you might have a higher level of stress, but then that kind of goes back down. The toxic levels of stress, they kind of go up and they stay up, and it does damage to the body. So this is kind of a depiction of what stress does to the body and some of the systems that are impacted. So you have the brain. It's activating the adrenal glands, and they're releasing adrenaline and cortisol. Adrenaline's kind of getting the lungs pumping and the heart pumping, increasing blood pressure, and cortisol is getting, the liver to convert or to produce glucose, which is essentially energy. So it's preparing the body for action, kind of ramping things up. But if there's no action necessary, then your body is kind of preparing for action over and over and over and over again, and for no reason. And there's not a decrease back down to baseline. So here, this is a depiction of kind of arousal and some of the responses. You don't have to read all this. I know the text is small. But on low arousal, you're kind of in this green zone here, safety, there's a sense of freedom, food. When you're meditating or when you're kind of in the zone or feeling comfortable, you're in this state here, and there are all these biological responses. A lot of these are restorative responses, so they help kind of repair the damage that the body experiences throughout the day. And then when arousal increases, you're kind of in this yellow zone here, and then the body is preparing for action, like we said earlier. So the action can be, to find something, to flee, to fight, to fawn over something, to kind of associate yourself with something. But there's a action urge that's created, the stress system creates, and that action urge, motivates people to act in some kind of way, and then that action kind of resolves the stressor. And then, the activation, the arousal goes back down to this green zone here. And that's kind of, the ideal scenario where people kind of exist. In this red zone here, if arousal increases, you can have kind of like a freeze response. People can faint. Basically, the body gets overwhelmed, and a number of biological systems kind of shut down. And that's kind of the extreme example of arousal, the extreme example of stress. But in all cases, there's an increase, and then there's some kind of activation or activity, and things gotta go back down to baseline. And so ideally that happens, and you go back down to baseline, you're getting all these restorative effects. But if you're constantly exposed to stressors, then your stress level, your arousal level never gets to go back down to that green zone. So it goes up, and then there's some kind of action, and then it goes back down, and then it goes up again. A repeated stressor goes up again, goes up again, goes up again, and then you're kind of constantly in this aroused state where you're constantly preparing for something that never happens, and it changes the sensitivity to stress, so that even a small amount of stress, in this case, because you're already at a higher level of stress, if there's a smaller level of stress, a small incident, it pushes you up to a much higher level of stress than you would if you were starting from baseline. So that kind of stress reactivity becomes traumatic in and of itself, and alters the biology, and the stress sensitivity, so that any little stressor becomes harmful. So they talk about social determinants of health. This is from the CDC. They mentioned discrimination. These are some of the things that the factors that make Black and brown people more likely to get sick and die from COVID. Healthcare access, occupation. People are more likely to be essential workers. Education, income, housing, all that stuff. But also exposure to police violence. So if you're in, a community where you're, exposed to police violence or the threat of police violence, and it is occurring kind of unchecked, then what do you do with that? How do you live with that? It's a constant threat, and especially when there's a lack of justice. You really have no recourse for how you kind of bring yourself and your stress levels back down to that baseline. So there are a few studies that have looked at the relationship between police interactions and the impact on mental health. There are 11 studies. This is a review from 2019. And they demonstrated, statistically significant associations between negative interactions with the police and poor mental health among Black Americans. It's not really that surprising. But in all of the history of this problem, have only been 11 studies done. And then among the 11 studies in that third point, only seven reported race and ethnicity as a demographic variable, but didn't consider its relationship to police interactions. So even amongst the studies that kind of included race as a factor, a number of them didn't really look at the interaction between race and police interactions. So, and this is kind of what they found. This is the PHQ is a measure of depression. So the black bars represent depression levels for people who have been exposed to police violence, and the white bars represent depression levels for people who have not been exposed. And you see, increases obviously for people who have been exposed. So this is kind of one finding that we're trying to replicate in Vallejo. I don't think it's going to be that hard to do. And another finding that, so we're trying to replicate this, and then we're trying to extend it to understand the impact of exposure to police violence on stress appraisal. So as we said earlier, if you're exposed to this trauma and there hasn't been any resolution, it's more likely to trigger kind of a stress response. So for people who've been exposed to the epidemic of police violence in Vallejo over years, it's very likely the case that they have kind of an increased stress response to things in general, which is making them sicker in ways, because it's wearing down their body and making it more likely that they're going to have kind of chronic health problems, and it's kind of the root of health disparities. It's kind of what people are talking about now. So, so the goal of this study is to kind of assess the level of exposure to police violence in Vallejo. I think it's important to get some numbers around that. There are a lot of people, who have experienced things in the community, and their voices are, not often taken seriously. So in one way, this is an attempt to kind of elevate some of those voices and get some numbers behind, what's been going on in the community, to assess the level of impact of this trauma. So, not only have people been exposed, but what sort of impact has it had on them? And then, there's the possibility of developing tools to adequately assess this. There are some tools out there. We're using some measures from the literature that look at, police practices and breaks it up into a variety of different categories based on some World Health Organization criteria. But a lot of, there aren't many tools, and they haven't been validated in populations that have experienced lots of violence. So it could be a little bit more rigorous and a little bit more nuanced. And then, so what's the point of all this? Well, once you have some data to kind of support what people are saying, then it opens the possibility of applying for, grants and funding and drawing resources into the community to help, address some of the issues that were raised in the study. So that's kind of like a long-term goal of the work that we're doing. So we've made contact with groups in the community. Obviously, this study doesn't make a lot of sense if you're not, reaching out to people who've been most affected by this. So we've connected with groups in the community like the Vessels of Vallejo and the Family Frontline Activist Movement, who's Rob Reason, who is organizing, a number of the different families in Vallejo who have lost loved ones due to police violence, and Corey McCoy, the brother of Willie McCoy. They are all, they've kind of signed on to this effort and have agreed to help us kind of reach out to community members and collect data from people who've been most impacted by this issue. Um, and that's about it. I mean, my orientation is kind of healing justice. So, one way to combat this problem is, through legislative and electoral routes. And, that's very important work. My orientation, I have a clinical background. So I think, focusing on the trauma that, people have suffered through state violence is also another route that should be focused on. I think public health departments, have a lot of work to do in this regard, because as we're seeing, the impact of this trauma is showing up in the COVID mortality rates and sickness rates, and we're finding that it's kind of the root behind some of the health disparities that we're seeing. So what is the public health response, to this? How do we build programs and resources that not only, help people manage some of the traumas that they've experienced, but stop these traumas from occurring in the first place? So I will stop there.
Thank you so much. And I want to just do a little shout out to the TUC students who are working with you on this project. I think there are two of them, and I think they're both joint PA and PH students. So very exciting. I'm just excited that we are part of this process. It is so important.
All right. Well, thank you all. Yeah, there's been a huge help. I mean, they really have helped move this along. So I really appreciate that. But it was good to see everyone. I got to take off.
Thank you.
Bye.
Have a great evening. And I know you're going to get your patient. Thank you.
Yeah, take care.